Let's talk dental care and pregnancy. Today on Dentistry Explained, we're going to talk about a few things to consider if you're pregnant, if you know someone pregnant, and how it pertains to their dental care. I am Dr. Jenny Perna. I am a dentist in South Florida with a focus in cosmetics, and my goal is to bring universal understanding of dental conditions to the world. Okay, you're pregnant, or maybe you know someone who's pregnant, or maybe you're thinking about getting pregnant, or maybe you just want more knowledge about dental care and pregnancy. And I am here to help you out. I am also pregnant, so we are on this journey together, my ladies. So let's think about a few things in pregnancy, and some things that happen, and some things that we can avoid, and some tips, tricks along the way. The first thing is I like to look at certain things that happen during pregnancy that don't maybe happen in our everyday lives. One of them is morning sickness, that dreadful, dreadful morning sickness. So whenever we have that sickness of actually vomiting, what happens is a lot of acid from our stomach comes up into our mouths. Well, what happens when we have acid in our mouths? Acid actually breaks down the outer surface of our tooth or the enamel of our tooth, which makes us more prone to cavities. Yuck. Well, how do we get rid of that acid? A lot of my patients will want to brush right away, and that is the last thing that you want to do. After any vomiting, you don't want to immediately brush your teeth. Why? Again, your teeth are weak right now. That acid has weakened your teeth. And if you start mechanically brushing your teeth, you can weaken it even more. So what do? You have this nasty taste in your mouth. You just threw up. You're not feeling good. You're in that first trimester. What I recommend doing is starting with a mouth rinse. Rinse your mouth out with a mouth rinse. Then drink lots of water. Those are really good ways to help get that bad taste out, and water is going to help start to neutralize your mouth as well. Then after 30 minutes, go ahead and brush your teeth. Pick something that's minty that won't make you throw up again. That way you can feel nice and fresh. So that's morning sickness. Another thing that I notice is constant snacking or frequent snacking. I know I was snacking so much in my first trimester to try and fight that nausea. And what we see when we constantly snack is that we tend to get more cavities or be more prone to cavities. When we're constantly snacking, again, that's gonna bring our teeth to an acidic state or our mouths to an acidic state. Then our teeth are gonna break down more and more and be weakened. So if you're gonna constantly snack, my number one thing is feed your baby and your body. Always, always, always take care of your pregnancy first and figure out how your dental care can fit into that. If you are someone who has to snack every so often in order to not go into a hypoglycemic state and feel good and know that you are fed, make sure you're drinking a lot of water. Also, finding really good protein-rich snacks is really good because cavities can be caused by ingesting carbohydrates that then leads to an acid that then leads to a breakdown of your enamel. We don't see those with those really nice proteins, so maybe find a nice protein snack. All right, what else happens in pregnancy that we don't really see outside of pregnancy? One is what we call pregnancy gingivitis. Pregnancy gingivitis is basically an inflammation in the gums. Gingia, your gingiva, itis, inflammation, gingivitis. So this is all due to your hormones. As long as you haven't had any diagnosis like periodontal disease and you know that from your dentist, usually those new bleeding gums that you're experiencing during pregnancy is all due to that hormonal change. You may notice more bleeding gums while you're brushing your teeth, while you're flossing, or just kind of regularly. So what do we do with pregnancy gingivitis? Well, we recommend continuing your normal oral health care. And what does that mean? Brushing every morning and night for at least 2 minutes, flossing at least 1 time a day, and using a mouth rinse. Those are your basics. Also, tongue scrapers are really good, even though those don't pertain to your gingiva. They're just really good in general, getting bacteria off of your tongue. And also, water picks are a really good resource as well to use as an adjunct with floss. Now, what does it mean in terms of your dental visits? We still recommend getting your regular cleanings while you are pregnant. Go in every 6 months for your cleanings and check up with your dentist. But if you are experiencing a lot of gingivitis, talk to your dentist about maybe increasing that interval. Maybe you go every 3 months or maybe every 4 months. There is no harm with that in pregnancy. But now that we're talking about dental care, what does dental care look like in pregnancy? Is it safe to even go to the dentist? Well, we already talked about how it's safe to get your regular cleanings. Please don't stop doing that while you're pregnant. But what about if you have pain? What if you need dental work? This is generally the rule of thumb. First, I always will get clearance with your OB, and a lot of dentists will do that. See what's safe for you, determined by your primary healthcare provider during this time in pregnancy. I typically try to avoid x-rays if we don't have to take them, meaning you come in for your regular checkup, you're not having any issues, we don't typically have to get x-rays as long as we have recent ones. But if you are in pain and you do need an x-ray, it is safe. We can take that x-ray. We'll put a lead apron over top of you and your belly to protect you and your baby to get that x-ray. Well, what about if you need dental treatment? It gets broken down into two categories. Is it an emergency or can it wait? Well, what can wait? Small cavities can wait. Anything that we don't think is going to become a huge issue during your pregnancy can wait. Well, what can't wait? We don't like to wait on any infections. Infections in the mouth will cause an increase of inflammation in your body, which can become unhealthy for you and your baby. And that can present either as a tooth infection or gum infection. So whenever we see those two things, we do recommend receiving treatment, even if it is during pregnancy. Now, the safest time to have treatment done during pregnancy is in the second trimester. But if an emergency occurs in the first or third trimester, we can do dental treatment and we'll take all the precautions necessary. Some of the precautions that we tend to take is we don't use epinephrine in our anesthetic. So that's a really great way to keep you safe, keep baby safe while we're performing dental procedures. And we did just talk for a second about periodontal disease or gum infection. Now, gum infection has been researched heavily in pregnancy, and what we tend to see is that if you have periodontal disease while you're pregnant, it can be very unsafe for you and baby. And mainly what we see is you can go into preterm labor and also you can have low birth rates. So if you do have that periodontal disease, we recommend getting that taken care of so we can decrease the probability of those things happening to you. Now, I did mention that I am a dentist and I focus a lot on cosmetics, but I'm also an injector of Botox and filler. And I often get asked by my patients if they can have Botox and filler while they're pregnant or breastfeeding. And my usual answer is no. Let's just wait. I know you're ready to get back to that Botox immediately or you're missing it tremendously during your pregnancy. I know I am, but it is way safer for you and baby if we wait until after you have given birth and if you're breastfeeding once you are done breastfeeding. Thank you for tuning in for this episode of Dentistry Explained, where we talked about pregnancy and your dental care. If you have any questions, please comment, make sure to like and subscribe for more answers to your burning dental questions.